today we have a very, very special treat. You guys have been following Jasmine's journey and her story, and she shared with us the last visit that she wants to be a chiropractor, and specifically a Gonstead chiropractor. Is that right?
Yep. Yep.
You ready for the challenge?
Yep.
Okay. And then we had another surprise come in. And this is Karina, who came from? Texas. Karina came about a year ago. And about a year ago, she came for a few visits. And she did well, right? She went back. And I'm going to let her finish that part of the story when she's up. Okay, I'll let you finish that part of your story. But she's back. And she's back with specific issues. She'll share her story. And we have new x-rays. We have new x-rays on Jasmine. We have new x-rays on Karina. And as I said, same thing, Karina has come. And I think in this year of researching her own stuff, you decided also.
Yes.
She decided also she wanted to become a chiropractor, hopefully a Gonstead chiropractor. But so I'm pretty excited today, and today they came and they're going to kind of work with each other today and see not just be the patient, but also see it from the doctor's side. Sound good?
Sounds good.
Cool. Jasmine, you're up first.
All right.
Welcome back.
Thank you.
Okay, so before we start, I want to go over your films. And the first thing I want to do is I want to put up both of the AP films. And I want you to tell me kind of what you see. Karina, she's given permission for you to be here. You've given permission for her to be here. All right. Can you please acknowledge it? Thank you. So I want to put up the AP films, and I want to kind of talk about what happened with you, Jasmine, along the way. This was how she presented a couple months back, right? And what we had going on here, we had this right pelvis. We had the sacrum. We were dealing with sacrum, pelvis, and a lot of other stuff.
Right.
But the main focus, we said, is what in this work? The foundation. So we have to focus, and we focused a lot on the foundation. You can go back to her 7 other videos and see it was all foundation, just kept going. So she had a PI2IN12. That means the right pelvis was down 2 millimeters. If the right one was down, left one was up, and internally rotated 12. Measure difference of 7 millimeters on the right. This is after 6 weeks. And let's look at it. Let's step back for a second. And why don't we look at it? Because what do you see? Jasmine, what do you see?
So, off like the bat, the spine just kind of looks the same because we were focusing on the foundation.
So tell me, what do you see here? Just what does it look like to you?
Like this top half right here, it just kind of looks the same.
Okay.
To me.
It looks more, doesn't it?
Right. You could even tell.
It looks more curved, doesn't it? Karina, does it look more curved to you too?
Yes.
Okay. So what did we do all this time?
We worked on the foundation.
So
There's the difference there.
let's start there then,
Yeah.
okay? Because this is not, and in your case, we are remodeling your structure.
Yeah.
Okay? If we look closer here now, she started with a PI2IN12. Now she only has 5 millimeters of rotation as opposed to 12. The up and down misalignments, that was PI2, those are even. So a lot of the foundation work went to what? Getting rid of a lot of the rotation of the pelvis. We still have the sacrum issue. Now that this is getting better and more solid, the true nature is coming out now. Okay, does that also make sense to you, Karina? Mm-hmm. Yeah? Okay, but I want us to see something else. Come a little closer. And I talked about this. There was a little bit of the spina bifida going on, right? Do you remember me talking about spina bifida? And if you want to see, it's non-union. This is S1 right here, okay? Right there. And if we look here, it's different. If I circle this here, you tell me what's different. Come over here, Jasmine. Look at that. I mean, I don't need you to tell me anatomy. I just want you to look. Does anything look different to you?
Yeah. I don't know. Just like the coloring too. Around this, it looks lighter than that one.
Okay. What about you, Karina? Anything look different to you?
It looks like it's a little bit more leaning inwards, like more straight versus like going slanted.
Correct. So we were focusing a lot on this bend of the sacrum, and the sacrum is starting to straighten out. And in the process of this bend starting to straighten out, that spina bifida is starting to heal. It's not supposed to. Okay? So, we do have work to do. There is also work when you go back home. This is a process. Okay? Now, let's go ahead and put up the lateral x-rays. The left one is where we started. The right one is where we're at. From a posture point of view, what looks different? Just looking at it. Come here, stand here. And if nothing looks different to you, nothing looks different to you. And while you're thinking about it, I'm going to do my posture assessment. And I'm going to see, you doing okay there, Shasha?
Oh, yeah.
All right, cool. This is just kind of Chiro freestyle with Dr. Rahim today. So, remember where you were at. This is how far back you were. This is where you're at now. You see that, Karina? So, we have things that overall shifting has happened, but a lot more specific needs to occur. Okay? And that's going to be over time. The neck looks, you're standing up a little taller.
Yeah.
Now, do you notice the rounding of the shoulders? Is it more habit? Are you noticing the habit now?
Yeah. Yeah, like when I start doing this, it's just like kind of pain and uncomfortable.
So it hurts now to,
yeah,
to go
as
forward.
before, like I would do this and it was like comfortable and I'd be fine. But now if I do this, it's like, it's just discomfort.
So you're catching yourself now.
Yeah.
Okay. Anything you want to share with us on this trip?
No.
Okay. Have a seat. Let's get started. And why don't you tell me what happened from yesterday, because we started to work on that foot.
Oh yeah, on my feet.
Tell me.
So since you did the adjustments on my feet, I just noticed, because you could see in my previous videos, I was, what'd you call it, pigeon toe? Where my feet
Toe in?
Yeah, toe in.
They call it pigeon toe. I just said toe in.
Toe in, so yeah, my feet would go in as I walk. And yesterday I was noticing that they were just more straight. And I felt it like in my knee.
Okay.
I just kind of felt it like from the foot up.
From the foot up, you felt what? Sorry.
It just felt different. Like it's not like pain or anything. It's just different.
Got it. So I got a tiny bit up in the atlas today, 5 points. You guys did a lot of movement yesterday?
Yeah. We walked a lot.
You're walking a lot while you're here,
Yeah.
right? Good. 10 points around T6, T7. Tell me about how the digestion has been in the last 2 months, 6 weeks to 2 months.
It's been a lot better. Before coming here, I just kind of ate smaller meals and not as frequently, just
Why?
because I wasn't hungry.
Okay.
Like I wasn't hungry. But now I'm just like, I'm hungry all the time, and I eat bigger meals.
Cool. Body's
That was
healing.
cool. Yeah, that was cool to see.
And body needs energy.
Yeah, and it gave me more energy. So now I have a lot more energy too.
5 points. So we're at T6, T7. We're at the sacrum and we're at the atlas today. Everything has been reduced. Now, can I check your pelvis? Feet together. Open and close the knees. So we know we have this right IN ilium. Feet together, open and close. Good. Right side only. So when she does the right, there is some shifting of the left side, but it's not from the ilium, it's coming from the sacrum, the pelvis. Do the left side only, please. Yeah, and then when she does the left, the shift is coming from the sacroala here. You feel that? Yeah. So we are going to continue on that right IN ilium. Now, can I have you round your back, please? Okay, now let's go ahead and do static palpation, starting at the base of the neck. As I run my fingers down the spine, we're looking for the edema, swelling, inflammation. You can see the pooling edema starts right there. Right there. You can see it right there. You see that, Karina, that little pool? Mm-hmm. You can even see the outline. There it is. More tender there or there?
There.
How about above? That one? That one.
The second one.
Yeah. So 1, 2, 3, 4, 5, 6. 7 is there. 6 is there.
Yeah, 6.
Now, the spinous of 6 of these areas, 4 to 8, is longer. So the nerve pressure would be at one spot, but the actual contact would be lower down when you look at the shape of the vertebrae. Yeah. So the nerve pressure is, we got it here at this level here. But the contact is down here to correct it. And if you contact at that level, you're actually above the actual segment. So you miss it.
Wow.
So you get the sound, you get the pops, it sounds good, it feels good, but you didn't clear the nerve pressure.
Okay.
You got to go back and look at that first video when I was doing this.
Yeah.
Completely different. Sacrum. Now, here's our challenge for today. We have today and tomorrow with you, Jasmine. Right? So, we have this IN ilium and we still have a little bit of a sacrum. Yes?
Yeah.
Not as bad. Yes. Yep. L5, S1, S2, or S3?
3.
Okay. S3, IN ilium, T6, and let's check up top. I'm a little suspect up top, and the only reason why is we've been doing 6 in pelvis, right? Why did that upper one show up today? Something off today?
No.
Activity-wise or anything? Then we're going to wait on that one. Okay? We're going to go ahead and we're going to start on the pelvis. We'll do pelvis. We'll do 6 and thing, just like before. I'll recheck this, the upper cervical. If it's still there, we'll work on it.
Okay.
If not, and then we got the feet. Cool?
Yeah.
Okay, so we're doing the IN ilium. Good? Hold.
Yep.
Okay. All right, so we're doing the IN ilium, push-pull. From the PSIS, we're on the medial border, pisiform contact. Relax that shoulder, please. Okay. There we go. IN ilium. We have to bring that elbow all the way down, and we're coming through this way. Hi. Gotcha. Come on up. What happened? Watch her walking. And what were you saying about your feet earlier?
They just feel more outward when I walk.
As opposed to turning in?
Yeah, instead of turning in. Like, I feel it, like, all the way to my knee. Like, even my knee is just out more, how it's supposed to be.
Correct. Very good. Let's go face down on the gray table, please.
Right here?
Yes, ma'am. Just lightly. Like,
Okay.
you're going to catch, don't push.
Okay.
Catch, don't push. Hola. How you going?
Good.
How you going? Colorado, huh?
Yeah.
Yeah. So, did you think about where you want to go to school yet?
No.
Okay.
I'm still looking.
You think about where you want to go to school? Cool. Hi. That's the home run. Thank you. Good stuff. T6. T6. Nope, we're done.
We're done?
You can
Alright.
throw the garbage out, please. Thank you, ma'am. Thank you. T6. Home run, lady. You good?
Yeah.
Good. Awesome. Nice. Tender? Yeah. Okay, so we also have the tibia issue we've been dealing with. And when we have a posterior tibia, so the tibia on the lateral side, posterior, it's called a PEX tibia. That's what we've been working on. You can feel there's a nice bulge of the lateral meniscus and capsule. This side is good. So anytime we're adjusting any knee, we have to work the capsule, whether it's lateral or medial, if there's a bulge. If there's a bulge and we don't work it, then guess what? It doesn't usually fix. Feels good, but it goes back. Hi.
Hi.
You ready?
Yeah.
Okay. We know this is not so fun, right?
No.
But you're okay with it, right?
Yeah.
Hold on to the top, please. Thank you. Traction, open up the joint, work the swelling back in. Traction, open up the joint, work it back in. You okay?
Yeah.
Okay. 5 more. 4 more. 3, 2, 1. Hold on to the table, please. You good?
Yeah.
Hi. Gotcha. Awesome. Let's walk that off once, Jasmine, please. I'll have you just.
That one hurt.
Did that hurt?
A little bit.
I'm sorry. Have a seat, please. And let's run the meter, make sure everything is clear. Come on back, Ryan. Let's start and see if Atlas is still there. Nope. So I probably could have you cracked your Atlas and made a bunch of sound today, right?
Yeah.
It's clear. Mid back is clear. Sacrum is clear. Mira. Número 5. Número 5. Bueno.
Oh, yeah.
Número 1.
Good.
Número 2.
Good.
Número 3.
Good.
Diferente.
Yeah.
Okay. Pelvis forward. Feet together. Open and close the knees. Left side only. Mira. Right side only. More shifting coming out of this sacrum. This is doing good. Cool. Questions so far?
No.
Okay. Sit back for me, please. All right, so what we're going to do now, we're going to check jaw, nose, and feet. Primero, How do you say jaw in Spanish?
Quijada.
¿Qué?
Quijada.
Quijada. Primero quijada. ¿Habla español?
Yes.
Sí. Sit back for me, please. Okay. Slowly open. Very cool. It's just a tiny bit at the very end. Close. That's really cool. Open. It's just a tiny bit at the very end. Very cool. Nice. Let us use the condyle block. Open all the way. Open. Close. Bueno. I'll need the ring off. And on your back, please. It's the fancy table today. The nose even looks different. Okay. We're going to be on the right side. Chin down, Jasmine. We got a lot of nose to pull today, yo. Gotcha. Nice.
Oh.
Breathe. Okay. Ready?
Yeah.
Okay. Let's walk that off. Tell us what's different, please, Jasmine, as you're walking, if anything.
Well, right now I just feel my nose.
Okay. Fair enough. All right. So now we need to work on the feet, okay? We did foot x-rays.
Yep.
We should probably put up the foot x-rays. You know what's really crazy in this office? There's not all these fancy toys, right? There's not all this fancy technology and everything. What is there?
Some tables.
A couple of tables. For what?
Adjustments.
That's it. Adjustments. All right. We did take some x-rays of your feet. These are Jasmine's x-rays. I'm asking her to just look just from your point of view. Tell me, what do you see?
So like from the left side, you can see that there's this line right here, which is darker than this line on this side.
Aha. So what that is, that's a lucency. And the lucency means it's the joint space. If lucency is clear, right? Unfortunately, I only have a right model. Okay? But what you're seeing is this bone right here. That's the navicular. 1, 2, 3 cuneiforms. Medial, middle, lateral. Thank you. Took me a minute. So we're seeing the joint spaces open there, making your toe do what? Correct. And what did we do? We pulled it.
Yep.
We pulled it. It set pretty nice that
Yeah.
time. And it changed the mechanics of
Yeah.
her feet now.
That's interesting.
Okay. This is where it's at. So on the left, we're working on both talus. We're working on the navicular and the cuneiforms. The first cuneiform. More so on the left than the right. On the right, what do we know? What do we see more so? We actually see more of this, right?
Yeah.
They're both jammed in there, but you can see more whitening of this joint. Means it's been there longer.
Okay.
So the initial injury was probably on the right side.
Okay.
Is that correct?
I don't remember any injury there, but
Okay.
yeah.
So I'm going again based on mechanics.
Yeah.
So we're going to set talus, we're going to set cuneiform, we're going to set navicular, and then remember that last piece of the puzzle? Remember that one you were face down? You don't remember.
No.
Okay. Questions on that?
No.
These are the laterals. Same thing, left side, right side. And what are we seeing here? So we talked about the middle cuneiform, and that middle cuneiform, you can see that gap versus that gap. Yep? And you can see that gap versus that gap. Yep. Okay. So we shall continue now. Let's work on your feet. What's the alternative? What's the alternative? What is the alternative? I have no idea. Okay. All right. All right, left side. Oh, yeah. Any questions, Karina, on what we've been doing? You're just watching.
Just watching.
Okay. Working periarticular swelling. Any questions, you, Jasmine?
No.
When is it going to stop? 5, 4. And I go as much as the patient will let me, okay? That's really it. If it's too much, just tell me, I'll stop. Okay? There it is. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. Now let's do this side. Oh yeah. Are you having fun yet? Not yet? Okay. So you changed your majors. Or you didn't change. You changed your career path.
Right.
So what's the plan now going back?
Well, I want to finish our CSU, so.
Good.
And then I'm looking at
How many
schools
years?
after that.
How many years do you have?
2.5.
Okay. 4, 3, 2, 1. Okay, let's set it. Talus. AS talus, medial tilt. Nice. AS talus, medial tilt. All right, turn to your left side, please. Bend the top knee and the bottom. I'll set the navicular with the speeder board. And the other side, we'll set the other navicular as well. And on your back, please. And now we got to pull the first cuneiform. What's interesting is it looks like we're pulling on the talus, but we're actually up here, close to the first metatarsal. So that's the metatarsal, the first metatarsal or the big toe, and it articulates first with the cuneiform. You feel that? Mm-hmm. Right, that one.
Yeah.
That one. And that's the navicular. Now here's what's interesting. This one, the cuneiform is superior, whereas the navicular is inferior. So the cuneiform is a pull. It's tight, yo. Hold on to the edge there. That's a little bit. Now the other side. There you go. A little bit more. There. Tiny bit more. There you go. Nice.
Yeah.
Nice. Okay, stand up. Stand up and let's go face down then. So what am I doing here? I'm working a little bit of the scar tissue around the middle or the second cuneiform. Okay? Actually, I'm going to use the comb. You get the bone comb. Get a little more of that scar tissue out for her. Corinna, you ever think you're going to be there watching? Did you ever think you're going to be there watching like that?
No.
You're live, yo. You know that. What's going through your head right now as you're watching? I'm very curious.
It's pretty interesting. interesting. It was the first time I ever seen like more footwork as far as like adjustments.
That's the grit. How you doing there, Jasmine?
Good.
How you doing? How you doing? 5, 4, 3.
Whoa.
Yeah. Can you deal with it?
Yeah, but it just got weird.
We got to change the foot mechanics. You know that, right?
Yeah.
It doesn't happen just by going 4, 3, 2, 1. Ah. Remember, we're joking a little, but if it's too much, you just tell me and I'll stop. Okay? I just always have to make sure we say it. This one's not so bad. See the difference there?
Yeah.
That one's not so bad. 4, 3, 2, 1. Off the third ray. Second cuneiform. Other side. That's great, nice. Off the third ray. You good?
Yeah.
Gotcha. Come on up, please, and let's walk it off. Alrighty. What's that?
My feet feel weird.
Tell me what's different.
I don't know. Like I feel it more in my right. Like it kind of feels more outwards. Like it feels like I'm pushing it outwards, but I know it's straight.
Say that one more time.
So my right leg, I feel like my body's almost like intentionally pushing it outwards.
Okay.
That's how it feels like. But I know it's like straight. And that's how it's supposed to be. Just because my body's not used to that.
Correct.
But yeah, I feel it more in the right.
Have a seat, please. Let's rescope. Neck is still clear. Six is still clear. No! It's clear. All set. Let's check the hands. Any questions for me, Jasmine?
No.
So we got one more visit tomorrow with you, right?
Yeah.
We're working on the feet. We still have work to do.
Yeah.
It's a process now. And,
Yeah.
you know, you're going to be in college now, still another 2 years before chiropractic college.
Yeah.
So we'll figure out the process.
Yeah.
Okay? Squeeze my hand. Squeeze. You guys did something yesterday. You're not telling me.
Went to the beach.
Yeah, something. You played a little extra yesterday. That's what happened. Squeeze. Good. It's all good. Questions?
No.
We did your jaw?
Yeah.
We did your nose?
Yeah.
Peace out.
Thank you.
Okay, now it's Karina's turn.
Okay.
So you get to watch her.